Healthcare personnel are in a position to recognize potential abuse, neglect, and exploitation. In fact, many states recognize certain health professions as mandated reporters. That means individuals in those professions are required by law to report suspicions of child, elder, or dependent adult abuse, neglect, and/or exploitation. Dependent adults are persons 18 to 60 years of age who have physical or mental limitations that restrict their ability to carry out normal adult responsibilities. You should be alert to patient signs, symptoms, and circumstances that could indicate abuse and follow your organization's policies for reporting. You are not required to provide proof of abuse or neglect. Only the facts leading you to believe abuse or neglect could have occurred or could be occurring. As long as reports are made in good faith and there is reasonable suspicion of abuse, reporters are generally protected from civil and criminal liabilities. Abuse, neglect, and exploitation. Abuse encompasses physical, sexual, and emotional forms of abuse, neglect, and financial exploitation. Physical abuse is the intentional use of physical force that results in physical injuries. Examples include hitting, kicking, shaking, burning, or other methods of harmful force. Sexual abuse involves pressuring or forcing a person to engage in sexual acts. Emotional abuse refers to behaviors that harm a person's self-worth or emotional well-being. Examples may include name-calling, shaming, rejection, withholding love, and threats of harm. Neglect is the failure of a person having custody or care over a child, older adult, or dependent adult to meet the dependent person's physical and/or psychological needs. It includes housing, food, clothing, and access to medical care. For children, neglect also includes failing to meet educational needs. Exploitation occurs when a person who stands in a position of trust or confidence with an older adult or person with a disability, knowingly, by deception or intimidation, obtains control over the property belonging to the vulnerable person or illegally uses their assets or resources. Indicators of child abuse. Seductive or promiscuous behavior. Parental behaviors. A parent's or other caregiver's demeanor may send red flags about possible abusive behavior and may include ignoring physical or emotional distress in a child, blaming a child for adult problems, unrealistic expectations of a child. For example, expecting an 8-month-old child to be toilet trained, unduly harsh and rigid rules and discipline, berating, humiliating, or belittling of a child, using belittling terms such as worthless, bad, or evil, showing little concern for the child, delay in securing medical care. Indicators of elder abuse. It is important for healthcare personnel to be vigilant in watching for signs of potential elder abuse. When physical and behavioral indicators are present, ask questions. Look for patterns and unusual changes in appearance and behavior. Physical indicators. Examples of physical warning signs include suspicious bruises, scars, and/or welts, drug overdose, under-medicating, broken eyeglasses or frames, signs of being restrained, such as rope burns on the wrists, ankles, or neck, broken bones or dislocations, bruising around the breasts or genitalia, torn, stained, or bloody underclothing, unexplained vaginal or anal bleeding, malnutrition or unexplained weight loss, dehydration, pressure injuries, poor hygiene, unsuitable clothing for the weather, missing medical aids such as walkers, dentures, hearing aids, and medications. Behavioral indicators. Behaviors an abused older adult may exhibit include anxiety, depression, or confusion, withdrawal from family and friends, implausible explanations for injuries, rocking back and forth, mumbling. Abusive caregivers. Abusive caregivers may provide warning signs such as indifference, anger, or aggression toward the older adult, a lack of affection, conflicting explanations for physical injuries, preventing the older person from talking alone with healthcare personnel, demeaning, belittling, and humiliating statements to and about the elderly person, a history of mental illness, substance abuse, domestic violence, or criminal behavior. Indicators of exploitation. Financial exploitation of an elderly person or dependent adult can be perpetrated by someone the person knows or does not know. Indicators. Indicators of possible financial exploitation may be more difficult for healthcare personnel to identify. However, if you have suspicions about financial abuse, you should ask questions and take action to make a report. Indicators to look for include evictions, unpaid bills, or utilities being discontinued due to non-payment. a lack of understanding about their financial situation, substandard care, even though the person can pay for it, ATM withdrawals the person could not have made on their own, being coerced to sign powers of attorney, advance directives, or other legal documents, missing belongings and property, such as health aids, clothing, and medication, implausible explanations about the person's finances by the perpetrator, people who show an unusual or excessive interest in how much the vulnerable person is spending. Perpetrators often have financial difficulties, gambling problems, or substance use issues.